As of Wednesday, May 13, 2026, international health agencies are responding to an active and evolving public health emergency involving a multi-country cluster of hantavirus infections. The World Health Organization first received notification of the situation on May 2, 2026, from the United Kingdom regarding a cluster of severe acute respiratory illnesses occurring among passengers and crew on a Dutch-flagged cruise ship, the MV Hantavirus, operating in the South Atlantic. This situation has rapidly transitioned from an isolated medical event into a coordinated global surveillance effort involving the CDC, the European Center for Disease Prevention and Control, and Africa CDC. Current data as of May 8 indicates that there have been 8 reported cases in this cluster, which includes 6 laboratory-confirmed infections and 2 probable cases. The severity of the virus is underscored by a case-fatality ratio of 38%, with 3 deaths confirmed so far. The pathogen has been identified through polymerase chain reaction testing and sequencing as the Andes virus, a specific strain of hantavirus known for its high mortality rate and unique transmission characteristics. This outbreak is notable not only for its mortality rate but for its occurrence in a confined, mobile environment, which complicates international contact tracing efforts across 23 different countries. To understand why this specific development is a priority for global health editors, one must look at the broader landscape of hantavirus surveillance. Data from the Pan American Health Organization shows that throughout 2025, hantavirus remained a persistent and lethal threat in the Americas. 8 countries in that region reported a total of 229 cases and 59 deaths, resulting in a regional case fatality rate of approximately 25.7%. This represents a significant baseline of infection in countries like Argentina, Brazil, Bolivia, Chile, and the United States. In particular, Bolivia and Paraguay saw significant increases in incidence in 2025, with some areas reporting case numbers that doubled their historical averages. Hantaviruses are a family of viruses spread mainly by rodents, and they typically manifest in 2 distinct clinical forms: hantavirus pulmonary syndrome, primarily seen in the Americas, and hemorrhagic fever with Raynaud syndrome, which is more common in Europe and Asia. While the European region saw a lower rate of infection in recent years, approximately 0.4 per 100,000 people, the high fatality rates associated with the American strains, particularly the Andes virus, keep surveillance teams on high alert. The virus is often characterized as a hidden hazard because it persists in the environment long after the animal hosts have departed, turning seemingly normal domestic or worker spaces into potential biological hazard zones through the accumulation of microscopic residue. The current situation in May 2026 serves as a critical reminder that while these infections are relatively uncommon on a global scale, their impact on the individual and the pressure they place on intensive care resources are profound. The core developments of the current May D26 outbreak reveal a complex web of logistics, clinical deterioration, and high-level laboratory analysis. The vessel involved, the MV Hantavirus, departed Ushuaia, Argentina, on April 1, 2026, embarking on an itinerary that included remote ecological zones such as Antarctica, South Georgia, Tristan da Cunha, and St. Helena. According to investigative reports from the World Health Organization and the Africa CDC, the index case most likely acquired the infection through environmental exposure in Argentina prior to boarding. This individual died on board the ship on April 11, 2026. However, the subsequent timeline of symptom onset for other passengers, ranging from April 6 to April 28, suggests a more alarming possibility: human-to-human transmission. The Andes virus is the only known hantavirus capable of spreading between people, typically requiring close and prolonged contact. The CDC issued a Health Alert Network advisory on May 12, 2026, confirming that sequencing has finalized the identification of the Andes strain. Laboratory testing in South Africa and Europe has been exhaustive, utilizing extensive respiratory pathogen panels to rule out other etiologies before confirming hantavirus via PCR on May 2nd. The clinical progression of the victims in this cluster has been documented as rapid and severe. Symptoms began with fever and gastrointestinal issues, quickly escalating to pneumonia, acute respiratory distress syndrome, and shock. Currently, the survivors are receiving treatment in highly specialized facilities across the globe. One patient remains in intensive care in Johannesburg, South Africa, while others are hospitalized in the Netherlands and Zurich, Switzerland. The international response has required the coordination of national IHR focal points to monitor 147 individuals who were on board, including 34 who had already disembarked before the cluster was fully recognized. The CDC deployed a specialized team to meet the vessel in the Canary Islands, Spain, following its transit from Cape Verde. This team is tasked with assessing the exposure risk for passengers and implementing strict monitoring protocols for a 45-day window. While agencies like the ECDC and WHO currently assess the risk to the general global population as low, the risk to the specific cohort of passengers and crew remains moderate. The logistical challenge is immense, as the ship carried individuals from 23 different nations, requiring a seamless flow of data between the Africa CDC, the ECDC, and the US-based CDC Emergency Operations Center. Contrastingly, while some early reports suggested a wider ship-borne contagion, verified data currently limits the confirmed cases to a small, high-risk group, though investigations into the full itinerary and potential environmental exposure factors are still ongoing. Prevention and surveillance remain the primary tools for mitigating hantavirus risks, as medical science currently offers no licensed vaccines or specific antiviral treatments for the infection. Public health guidance from the CDC and the National Emerging Special Pathogens Training and Education Center emphasizes that the most critical intervention is the management of the domestic and work environment to prevent the inhalation of aerosolized viral particles. Officials state that the virus is transmitted through the urine, feces, and saliva of infected rodents, which can become airborne when disturbed. To avoid creating a biological hazard zone in the home, the guidance is specific. Never use dry sweeping or vacuuming methods in areas where rodent activity is suspected. Instead, these areas must be thoroughly wetted with a 10% bleach solution for at least 5 minutes before any cleaning begins. This wetting process is essential to prevent the virus-laden residue from becoming an inhalable mist. Health agencies recommend wearing gloves and, in high-risk scenarios, a fit-tested N95 respirator. For those living in rural or peri-urban areas, sealing entry points and using rodent-proof containers for food storage are considered standard preventative measures. The medical community remains honest about the limits of current knowledge regarding hantavirus. While the 2026 cluster has brought the Andes virus into the spotlight, much remains unknown about the exact environmental factors that influence viral stability and aerosol survival. Clinicians are advised to look for a specific set of indicators that suggest hantavirus pulmonary syndrome, including thrombocytopenia, hemoconcentration, and a rapid onset of respiratory compromise. Early recognition is vital. While there is no cure, aggressive supportive care in an ICU setting, including the use of extracorporeal membrane oxygenation or ECMO, can increase survival rates to approximately 80% if initiated early. However, the window for this intervention is narrow, as patients can deteriorate within hours. For the ongoing 2026 cruise ship situation, the public is advised to remain calm, as the public health risk to the general community is extremely low. Surveillance will continue for the duration of the 45-day monitoring period for all exposed individuals. Public health officials conclude that vigilance, environmental hygiene, and early clinical reporting are the only reliable defenses against this rare but high-consequence pathogen. For more updates on global health surveillance and reporting, consider subscribing to our channel. The core of this international public health development revolves around a complex chain of clinical progression, laboratory confirmation, and high-stakes logistics coordinated across 3 continents. As of mid-May 2026, the investigation into the MV Hantavirus cluster has transitioned from a localized medical emergency into a full-scale forensic epidemiological operation. The timeline began when the vessel departed Ushuaia, Argentina, on April 1 with an itinerary covering several remote ecological zones. The index case, a passenger who likely contracted the virus in Argentina before boarding, exhibited symptoms early in the voyage and died on April 11. What initially appeared to be an isolated incident quickly escalated when 7 additional individuals, comprising both passengers and crew, began exhibiting high-grade fevers and respiratory distress between April 6 and April 28. This secondary cluster is the primary focus of the Africa CDC and the European Center for Disease Prevention and Control, as the staggered onset of symptoms strongly suggests human-to-human transmission. This specific mode of spread is a hallmark of the Andes virus strain, setting it apart from other hantaviruses that typically require direct contact with rodent excreta. In the laboratory, the diagnostic process was exhaustive. Initial reports from the ship's medical bay were corroborated by sophisticated testing in South Africa and European reference labs. Scientists utilized comprehensive respiratory pathogen panels to systematically rule out more common viral and bacterial etiologies before narrowing the focus to viral hemorrhagic fevers and hantaviruses. On May 2, 2026, polymerase chain reaction, or PCR, testing confirmed the presence of hantavirus genetic material. Subsequent genetic sequencing finalized the identification as the Andes strain. This laboratory certainty allowed the CDC to issue a Health Alert Network advisory on May 12, providing clinicians worldwide with specific parameters for identifying and managing potential secondary cases. The laboratory data is critical not just for treatment, but for refining the scope of the contact tracing operation, which currently encompasses 147 individuals who were on board the vessel at various points of its itinerary. The logistics of managing this outbreak are unprecedented due to the mobility of the passenger cohort. By the time the cluster was officially identified, 34 individuals had already disembarked and traveled to their home countries, necessitating the activation of national IHR focal points in 23 different nations. The MV Hantavirus itself was intercepted by Spanish health authorities in the Canary Islands following its transit from Cape Verde. A specialized CDC response team was deployed to the islands to conduct on-site risk assessments and environmental sampling. This team is focused on determining whether the virus remained viable in the ship's ventilation systems, or if transmission was strictly limited to close, prolonged contact among the affected group. Currently, the medical status of the survivors is being monitored in high-containment facilities. One patient remains in a critical care unit in Johannesburg, South Africa, while 2 others are receiving specialized respiratory support in the Netherlands and Zurich. Switzerland, the data provided by the World Health Organization and the Pan American Health Organization, emphasizes the lethality of this specific pathogen, with a case fatality ratio of 38% in this cluster, surpassing the 2025 regional average of 25.7%. The clinical urgency cannot be overstated. Health agencies are now contrasting the confirmed data from the MV Hantavirus with broader 2025 surveillance figures, which showed 229 cases and 59 deaths across the Americas. The 2026 event is being treated as a high-consequence anomaly due to the confined environment of the cruise ship. Surveillance protocols are now strictly defined. Every individual identified as a contact must undergo a 45-day monitoring period, which is the upper limit of the virus's incubation and transmission window. While agencies like the ECDC maintain that the risk to the general public is low, the intensive resource allocation required for this single cluster highlights the profound pressure that hantavirus outbreaks place on global health infrastructure and the vital importance of rapid, transparent international data sharing. In the wake of the May 2026 Andes virus cluster, global public health guidance has been recalibrated to address both the immediate containment of the current outbreak and the long-term management of environmental hantavirus risks. Prevention remains the primary defense, as medical science currently offers no licensed vaccines or specific antiviral therapies for these infections. Public health officials emphasize that the most critical intervention for the general public is the management of the domestic and work environment to prevent the inhalation of aerosolized viral particles. According to official protocols from the CDC and the National Emerging Special Pathogens Training and Education Center, individuals must treat areas with suspected rodent activity as potential biological hazard zones. The guidance is specific. Never engage in dry sweeping or vacuuming in these spaces, as these actions launch dried viral particles into the air. Instead, the area must be thoroughly saturated with a disinfectant, ideally a 10% bleach solution, and left to soak for at least 5 minutes before any cleaning begins. This wetting process ensures that the virus-laden residue remains heavy and cannot be inhaled. Protective measures include the use of rubber or plastic gloves and, in higher risk or enclosed environments, a fit-tested N95 respirator to filter out microscopic pathogens. Surveillance and public guidance for the current multi-country event are governed by a 45-day monitoring window, which reflects the maximum known incubation and transmission period for the Andes strain. For the 147 individuals identified in the Hantavirus contact tracing effort, this involves daily symptom checks and mandatory reporting to local health departments across 23 nations. The goal of this intensive surveillance is to identify the early prodromal phase of the illness, which typically presents as fever, muscle aches, and gastrointestinal distress. Officials state that the transition from these initial symptoms to hantavirus pulmonary syndrome, characterized by acute respiratory failure and shock, can occur with alarming speed, often within hours. While there is no cure, the data indicates that early hospitalization and the use of advanced supportive care, such as extracorporeal membrane oxygenation or ECMO, can significantly improve outcomes. In facilities equipped with these specialized life support systems, survival rates can reach approximately 80%. Provided the intervention begins before the onset of severe cardiopulmonary collapse. The scientific community remains transparent about the significant limits of current knowledge regarding hantavirus. While the 2026 cluster has provided critical data on the Andes strain's capacity for human-to-human transmission, much remains unknown about the exact environmental factors that influence the stability of the virus in various climates and settings. There is ongoing research into why certain years, such as 2025, see massive spikes in rodent-borne transmission across the Americas, where cases in some regions of Bolivia and Paraguay doubled their historical averages. Public health agencies acknowledge that while the risk to the general global population is currently assessed as low, the hidden nature of the virus, persisting in dust and residue long after a rodent has left, necessitates a permanent shift in how we approach environmental hygiene in rural and peri-urban areas. The ethical imperative for health agencies remains a balance of vigilance and calm, providing the public with the tools for self-protection without inducing unnecessary alarm. As the 45-day monitoring period continues for the current cluster, officials conclude that the best defense is a combination of rigorous environmental exclusion of rodents, rapid clinical reporting, and a commitment to international transparency. For continued updates on this developing public health situation and global surveillance efforts, consider subscribing to our channel.